Hi, Tracy. I'm recording you. Say hello to the incoming applicants.
Hi! Oh my god.
How's your day going?
Oh, not bad. I just came back from a consult.
Excellent.
In this year of COVID. It's very different. Hi guys. Let's go. So this is our fellows room. A little bit messy right now because we haven't been using it a lot, but cozy. And as you can see, computers for 4 of us. Our second year Ben usually sits here. This is Baggy's workspace. That's
Is that Ben? Is that Ben here? We should feed him more.
Baggy, my first year co-fellow, sits here. This is my workspace, and that's Jessica's workspace, and that's her right here with her husband Zach.
So you're able to snag the window seat?
Yeah, actually, yes. So I think I'm going to be keeping this one next year. Yeah, actually, I like my spot. So, yeah, this is pretty much where we do everything. We, mostly 2 of us are here at any given time, Baggy and myself. And we also have the medical students with her. That was in here as well. That was pre-COVID. I don't know how that's going to work going forward come July, but we'll see. But yeah, this is our little hub. A lot of things go on here.
Thank you, Tracy.
Looking forward to meet you guys.
Study nook here with a nice view. And we're going to go downstairs. We're up in the clinic. You can see we have our ultrasound machine ready. This is our clinic where patients check in. Hello.
Hello.
And the charting room. Hello. This has been one of our second year fellows. The room is usually packed, but due to COVID-19, it's pretty much empty. But this is where, under normal circumstances, we sit and chart between patients. And here we have Laverne Blake, our office manager.
Hi, welcome to the Rheumatology Clinic. It is one of the most wonderful clinic, entertaining, educational clinic. The providers are awesome, and we want to welcome you and let you know that we are here to support you 100% through your journey. So please choose us as we choose you. Thank you.
Thank you, Laverne.
You're welcome, Dr. Kissin. You're awesome too. Bye-bye.
Yes, hello prospective fellows. My name is Melissa Kardonsky. I am the Director of Operations for the Rheumatology Clinic here at Boston Medical Center.
And I'm Ashley Pliska. I'm the Operations Manager in the Rheumatology Clinic here at BMC.
And so what do you guys do with the fellows?
So I think our interaction with the fellows is really to be a resource for them. So if something in the clinic isn't going well, or if there's something that they need, we would be the point people to help resolve any issues that come up. We also work with the fellows to manage their schedules. So any changes that they need to make would go to me or Melissa. Yeah.
Great. And what do you think about working here at BMC?
I think working at BMC is such an exceptional place to work. We have such a diverse patient population and a really high level of complex patients that really offer our fellows a really good learning opportunity.
Great. And why should our applicants come here?
I think just to kind of go off of what Melissa said about BMC, I think it's a great place to work. I'm genuinely proud to work here. A lot of outreach to the community and programs that we offer to our patients are great. As far as the clinic, I think we've put together a great team. Everyone from the MAs, nurses, front desk is willing to do whatever is needed to be done to help the clinic run smoothly for our patients and their providers.
Well, I'd like to thank you both for what you do.
Yeah, thank you
Thank
so
you.
much.
All right, thanks. Bye. Hello, Aman.
Hey, hello, fellow applicants. I think you're starting your journey to the best place, BMC, and probably in Massachusetts, and maybe in the world. That's how I feel about the rheumatology clinic at the Boston Medical Center. So my name is Emmanuel Cajasa. I'm the clinical pharmacist. I've been here for about 2 years now, and honestly, this is the best decision I've made in my career path, and I hope you're gonna feel the same as well. So here what I do is I happen to have a joint clinic with the providers and have an opportunity to interact with providers about medication therapy choices, dose adjustments, and adverse event management, adherence, and etc. and etc. And the providers allows me to practice at the the extent of my license. So I hope you will have that opportunity, and I believe you will, and you will be working with the great rheumatologists that I ever know so far. So
Thank you, Aman. And they'll have a chance to work with you, and you're one of our heroes. So one of the big reasons to come here.
Yes, I hope I will not disappoint you. That's a big burden that Dr. Kissen is putting on my shoulder, but I will strive to live up to that standard.
Thanks so much.
Thank you.
Hello, Nancy.
Hello, Gene. What can I do for you?
You can tell our prospective fellows what they can expect to see at BMC and rheumatology.
Well, if they're anything like me, they're going to see an incredibly cohesive, intelligent, hardworking, and supportive staff of physicians, which is one of the reasons I have been here for over 10 years. I also think they're going to see incredible pathology. They're going to see a lot of unusual cases, as well as a lot of really good, clean rheumatology. And we have some great, I don't know how to say it. We have a lot of great opportunities to be yourself while you're still able to become an excellent rheumatologist. And I don't think I've always seen that everywhere I've gone. So I highly recommend working at Boston Medical Center Rheumatology here at BU. I've always been proud to say that I work here, and I think you would be too.
So when would they interact with you?
That's another good question. It would depend on how well they take care of their patients. I actually get most of the phone calls from patients that need something in between their visits here to the clinic, be it a refill, be it that they're having a flare of their disease, if they're having some sort of a socioeconomic problem. The phone call usually comes to the nursing staff to be triaged appropriately, and the fellow is many times responsible to handle whatever that medical issue is at the time. And we work fairly closely together to try to make sure the patients get the best care.
Great. And do you evaluate the fellows?
I do evaluate the fellows, which is from a nursing perspective. So basically, I'm evaluating the fellows as to how well they're able to work with the paraprofessionals, the other professional staff, to work with the patients and their families and make the patient experience a little easier. So that's where my evaluation comes in.
Great. Now, how did you earn that Best of Boston, Nancy Figueredo at Boston Medical Center there?
Well, funny you should ask. That was one of our former rheumatologists who's now currently the chief at another facility, recommended that Boston Magazine talk to me about emergency nursing and navigating the system, because I had been an emergency nurse in the past. When they spoke to me, it was supposed to be 300 nurses. And they called me up and said, you know what, we listened to what you had to say and we decided to change the avenue we're taking. And they came and sent a photographer and did a highlight on me. This Boston Magazine is as a voice for nursing.
Well, and they get to work with you if they come here.
They absolutely do.
So
I
thank you.
haven't had many complaints as yet, Dr. Kissin.
Thank you, Nancy.
My pleasure.
Bye. This is also the way you're going to walk when you go to the hospitals to do consults. On the right are some of the office buildings. Used to be the main part of the hospital. You can see in the distance there, Menino Pavilion, that's where the inpatient wards are. Here on the left is which is where the amyloid center resides. The rheumatology department started off as the amyloid center back in the 1960s. Now it's primarily run by hematology. And we're back to the School of Medicine. This is our lab. You can see the extensive lab space. And this is our double-headed polarizing microscope. So we can come here and look for crystals and be able to supervise your learning how to do polarized microscopy.